give a brief about it. Exosomes. Exosomes are small little nanoparticles, nanospherical particles, which all cells secrete, and they contain a message to another cell to go and do a very specific thing. These have now been found to be the active end of stem cells. So stem cells, as you've well known about stem cell therapy, stem cells secrete these vesicles in order to have the regenerative effect. As stem cells were shown that they do not turn into the target tissue, the theory behind stem cell therapy was if I give it for a liver cancer patient, it'll turn into liver cells. That was not the case. That has not been found the case. However, the desired clinical effect was there. And so it's now been shown that it's what stem cells secrete that causes the effect clinically seen, not what they become. And stem cells are a repair cell. They'll go into areas of inflammation and secrete these vesicles to induce repair in the local milieu. Now we have the ability to culture these cells and to just harness the exosomes and put them in a vial and look at them from a cosmetic as well as a therapeutic point of view.